In this video, we will be teaching you how to set up the GameReady, PowerPlay, and intermittent compression units. Before we get into the setup, we must know the indications and the contraindications for these devices. The indications for these three devices are post-traumatic edema, lymphedema, chronic pitting edema, and post-surgical edema. The contraindications are compartment syndrome, peripheral vascular disease, arteriosclerosis, deep vein thrombosis, local superficial infections, edema secondary to congestive heart failure, ischemic vascular disease, gangrene, dermatitis, acute pulmonary edema, and displaced fractures. The pre-application tasks consist of taking the blood pressure of each patient, because you do not want the pressure of the cuff to exceed the patient's diastolic blood pressure. You also want to take pre-circumference measurements of the treatment area. To start the setup, you are going to fill the device full of ice and water. When plugging the GameReady in, you want to make sure it is plugged into a ground fault circuit interrupter, and make sure the other end is plugged into the device. You want the patient in a position that is most comfortable to them. For the lower extremity, preferably long sitting. Then you are going to wrap the cuff around the knee so that it is snug. At this time, you will plug the hose into the cuff and the device. Now you will turn the device on and set the parameters. There are three pressure settings: high, medium, and low. The high setting is between 5 to 75 millimeters of mercury. Medium is 5 to 50 millimeters of mercury. Low is 5 to 15 millimeters of mercury. Select the settings so that it does not exceed the patient's diastolic blood pressure. Then you are going to place a bolster under the patient's leg and encourage active range of motion when the patient feels no pressure from the cuff. The typical treatment time is 20 to 30 minutes. After the treatment is over, you want to apply a compressive sleeve to further control the swelling. For this modality, you need a Sockinet, ice pack, sleeve, and the unit itself. You want to first apply the Sockinet to the patient over the area you are treating. The Sockinet should cover the whole treatment area and lay flat with no wrinkles in it. You want there to be a barrier in between the ice pack and the skin, otherwise the patient could develop frostbite. Then, with the ice pack in the sleeve, wrap it around the treatment area. Adjust the straps so they are tight. Then plug the cord from the sleeve into the unit and plug the unit into a ground fault circuit interrupter. Then turn the PowerPlay unit on and adjust the pressure settings either up or down, making sure not to exceed the patient's diastolic blood pressure. The treatment time typically lasts from 20 to 30 minutes, and when the treatment is over, leave the Sockinet on to help control the swelling. The next modality that we will be using is the pneumatic unit. For this device, you need a sleeve and the inflation motor. Set the patient up in a comfortable position for them. Put the sleeve over the desired area by sliding the extremity into it. Once the extremity is in, zip the sleeve up. Plug the air hose into the unit and turn the unit on. Turn the dial slowly to the right until a desired pressure range is met, remembering not to exceed the patient's diastolic blood pressure. The patient should feel one chamber at a time, filling up and placing pressure on the limb. This will start distally and end proximally and go back down proximal to distal. Treatment time is around 20 to 30 minutes. For all three of these modalities, the patient should never feel numbness or tingling in the hands and feet. If this is felt, the patient should let the clinician know and the treatment should be stopped.